1.
Hello, and thank you for joining our on-demand session on the intersections of civic engagement and public health. My name is Robin Mowson, Director of Immunization at NACCHO, and I'm here to set the stage with some background on why public health should care about civic engagement. Civic engagement is increasingly important on the health landscape and reflects the opportunities people have to participate and engage with others in their communities. Civic engagement encompasses the ways communities collaborate with each other or institutions to improve conditions through shared problem solving and decision making. This can include political activities such as voting and advocacy, but also includes community activities such as volunteering, mentoring, creating infrastructure, and civic education. We know because of ongoing research being conducted by organizations across the country, including county health rankings and roadmaps, that in places where there's better civic participation, health outcomes are better. What we don't know yet is whether there is correlation or causation. But maybe it doesn't completely matter if we just consider a focus on civic engagement as another arrow in the quiver for local public health to improve people's health. Additionally, within the past year, Healthy People 2030 raised voting from a research objective to a core objective because they think the body of evidence is strong, growing, and merits this elevation. While Healthy People 2030 specifically focuses on voting as a measure of civic engagement, it is only one piece of the puzzle, albeit an easier one to measure than other aspects, such as engaging in shared decision-making. Civic engagement is not all about politics, though. The definition of civic participation is broader than politics, and as I mentioned, includes practices that are apolitical or nonpartisan, including volunteering, infrastructure like creating shared community spaces, collaborating with libraries, and civic-minded organizations like Kiwanis or YMCA. We encourage you all to listen for these things in conversations, and you may realize you're already operating in the civic engagement space. Please, throughout this presentation, don't be overwhelmed by the breadth of this topic. This isn't something public health needs to do on its own. It's not just up to us, but it is the perfect place to partner. Listen for how and think about who might be working on these topics in your community. Perhaps you're already working with partners in this space through your coalitions. It is not all or nothing. There are options, so don't feel overwhelmed with the number of things that can be done in the civic engagement space. During this presentation, you will hear from two others, including Janesse Brewer, the Director of Stakeholder and Community Engagement for the Institute of Vaccine Safety at Johns Hopkins University, and David Martinez III, who is the Director of Strategic Community Partnerships at the Vitalist Health Foundation, based in Phoenix, Arizona. So now I'm going to pass to David to share more about how he and his organization are operating at the intersection of health and civic engagement.
Great. Thank you so much, Robin. It's been a pleasure to collaborate with you and the team at NACCHO, as well as Janesse and the great friends at Johns Hopkins University. As Robin mentioned, my name is David Martinez. I'm a director at Vitalist Health Foundation. We're based in Phoenix and have partnerships throughout the great state of Arizona. In my role, I get the great pleasure of overseeing our capacity building and grants program, as well as our portfolio area that we call Civic Health, which is what has me engaged with you all today. So what does that mean for us? Civic health is a broad term that we define as how communities are coming together every day to tackle their toughest challenges, and in our case, as a health foundation, to improve the health of their neighbors, their communities, our state, and ultimately our country. As a health conversion foundation, we have evolved how we see health as more than just health care, though access to care is certainly important, but looking at the broader social determinants of health, or what we call the elements of a healthy community, including the component of civic health. So we're excited to, again, partner with NACCHO and Johns Hopkins University to add to this growing body of research and a growing movement that, as Robin mentioned, is really being led in a big way by the Healthy People 2030 concept. So on the next slide, you'll see that, as Robin mentioned, for the first time, this concept of civic health or civic engagement, civic participation, including voting, has moved from a research objective to a core objective in the Healthy People 2030 effort, which is essentially our nation's strategic plan to create healthier Americans. It is a really monumental decision to have the Office of Disease Prevention and Health Promotion out of the Health and Human Services to elevate this concept of civic health as a key determinant of health. And as a health foundation, we are getting behind this concept 100%. I love this concept on the next slide that the Rear Admiral from HHS notes, because we know that healthcare is integrated. So the physical, mental, and the social determinants of health are all integrated. For physical health, in order to build that, we often exercise. We go for walks, we hike, we see a trainer, right? There, we flex our physical muscles to gain that health. For our mental health, we often talk to friends or family, get a dog, or see a therapist. That improves our mental health. But what do we do to strengthen and improve our civic health? And as the Rear Admiral says, voting is one way that we as individuals can flex our civic muscle to increase our civic health. So I love that kind of relationship that the physical, mental, civic health, and the social determinants of health have all together. So it's not just the Healthy People 2030 effort that is getting behind this. On the next slide, there is the message is really gaining ground in the health sector. So the National Academies of Science, Engineering, and Medicine, as well as the American Medical Association, the American College of Physicians, the American Public Health Association, and we, of course, are here with you today as part of the NACCHO 360 conference. So public health organizations have leveraged their voices in this growing movement and this growing body of research to show that civic and participation addresses determinants of health and makes progress on health disparities. Why does this all matter? I'm going to bring it down to Arizona for you, right? So here in Arizona, in the 2020 general election, only 66% of registered voters participated in our election. That went down in our midterm, where less than half of Arizona's voter registration, registered voters actually voted. So the science, the research is showing that the more people that let their voice be heard at the ballot box or by voting by mail, as we do here in Arizona, the likelihood of creating healthier behaviors and healthier policy outcomes happens. On the next slide, we have additional data that reflects that, you know, if for those that don't vote, they often see it as their vote not mattering. And for a state like Arizona, where key elections were decided by a slim margin, these behaviors, these perceptions matter. So we are really working hard to boost confidence in voting and ensure that Arizonans recognize that their voice does indeed matter. Of course, on the next slide, this matters for us because Arizona has been at the epicenter in the effort to protect democracy. It was our 11 electoral votes that were objected to on January 6th, as you see in the picture, that led to the insurrection at the Capitol. So as a health foundation and as an independent, nonpartisan health foundation, we are keenly watching efforts to erode our election processes and systems and advocate for greater election protection so that Arizonans have the ability to register and let their voice be heard on the ballot box. Why does this matter even still? On the next slide is a really kind of cheeky presentation that one of our state senators and former Secretary of State presents, showing the total sort of boxes of our general fund here in Arizona. So this matters because a big portion of federal dollars that come down to our states, and obviously as city and county health officials, we recognize this, a huge portion of federal resources come through programs down to the states, county, and city levels that impact our residents' abilities to live healthy. Obviously, this represents the state of Arizona, and a huge piece of health and welfare is reflected on this. But the other components, including education, transportation, those are all, again, the social determinants of health and elements of a healthy community. So when more people are engaging in voting, engaging in their community, letting their voice be heard, the better budgetary outcomes, the better health policy outcomes. So that translates to dollars coming down to our states. Still, it matters more. On the next slide, you see how we reflect the social determinants of health, or as I mentioned, as we call the elements of a healthy community. The concept of civic health, or again, you can say civic engagement, civic participation, democracy, is encapsulated in a social determinant of health as we define it within the social and cultural cohesion spoke of this wheel. But these are all intersected, right? And of course, we hold health equity and resiliency lens into all of this work. And this is really critical because, as we know, zip codes often determine life expectancy and not genetic code. So we really have to really look at the complete social determinants of health, including civic health, to ensure that that disparity is addressed. On the next slide, you'll see this concept of civic health. Again, how people and communities have the capacity to engage and unify to resolve problems. It's one measurement through the county health rankings and roadmap. So another connection to the NACCHO sector. So this data again makes a connection between civic health and thriving people and places. So as Robin mentioned, yes, it does include voting as reflected in this image at the city hall, but there are a myriad ways that people can boost their civic health, including going to the school board meeting that's tonight, or volunteering in their community garden, or letting their voice be heard through a protest or rally, or simply coming together with neighbors at a cafe or at a library. So there are, again, a lot of different ways where civic health can be represented. This matters again because in the next slide, you'll see here in Arizona, we are tracking that data to try to boost the civic health progress meters, including volunteering, spending time with neighbors, working with neighbors. And as you see here, Arizona falls below the national average for each of these civic health components. So here in Arizona at Vitalist, we are supporting local partners to boost the civic life and the civic health progress meters so that ultimately we can have healthier people and healthier outcomes. On the next slide, you'll see another representation of what this broad spectrum of civic health looks like. This is a civic engagement spectrum from our friends at Philanthropy for Active Civic Engagement, or PACE. And I love this because it again shows the wide diversity of efforts within the broader civic health or civic engagement spectrum. So at Vitalist, we try to take an upstream systems approach to our work, including in civic health. So we focus mostly on that upper left-hand corner around those reforms. So these rules of the game that are created that prohibit or allow more easily residents to engage in their communities through things like the census, redistricting, and election processes. But as Robin mentioned, things like volunteering, infrastructure, all of these different buckets of work are inclusive of civic health. So you can begin to ask yourselves, okay, as public health officials, as city and county health officials, where are we touching on this spectrum and leaning into this space as trusted community messengers? So at Vitalist, we've been looking at this total picture of civic health and thinking, okay, how can we add our voice, add our research and convening power to show this greater connection between being civically engaged and positive health outcomes, including health policy outcomes. And we've been partnering with the national group, Health and Democracy, Healthy People, Healthy Democracies, who have convened more data that compiles this Health and Democracy Index. So pulling some key public health indicators and overlaying that with the Cost of Voting Index, or COVI, which is a measurement through political science that tracks inclusive voting practices and then correlates that with public health indicators. So here you see some of the Arizona factors. We are kind of in the middle of the road when it comes to these public health factors. And on the next slide, you'll see how that correlates with, again, these inclusive voting practices. So states like Washington, Utah, Hawaii have more voting access and they have better health. States like Mississippi have less voting access and worse health. So Arizona is kind of in the middle of the road, but we want to be in that upper right-hand quadrant, which is why we've been working hard with our partners to strengthen civic health here in Arizona. This all, again, matters because we know that when there's increased civic engagement, there's better health policy and there's better health outcomes, as you see on the next slide. So these are just more tools in this growing movement and body of research that shows that the health and well-being of people and communities depend on active participation and engagement of residents. And it's why we at Vitalis as a foundation have prioritized strengthening civic health, including supporting community town halls, by inspiring charitable giving to inspire Arizonans to give to their favorite local nonprofit, by investing in place-based civic infrastructure areas, and by informing public policy and nonpartisan awareness building of this connection between voting and civic engagement with health, as well as other advocacy efforts in this space. So one of the things that I really try to emphasize when I'm presenting is, okay, David, these are all great ideas, but when I get back to my hometown or to my role, how do I implement this work? So on the next slide, I begin to convey some of that efforts. So as I mentioned at Vitalist, we take this upstream systemic change framework for our grant making and programmatic work. That includes those efforts that set the rules of the game, that prohibit or allow an Arizonan's ability to engage more easily in their communities. So we know that the census, the decennial census, often drives a lot of those data decisions, the dollar decisions that come down from the federal government, certainly the districts that are redrawn after the census, and the decisions that our elected officials can make. So we have invested in the census in really unique ways. So we know that Latino families throughout the country are often undercounted. They have been historically undercounted, and it is almost a kind of a double ding, because even if a Latino adult completes the census, they often don't count their children because they don't know they have to. So, and of course, we know that young children utilize a lot of federal programming like WIC and Kids Care that we have here in Arizona, the Child Health Insurance Program. So if they're not counted in the census, that really has this ripple effect for the next decade. So we worked with our local partners to simply have the census logo printed on onesies, and we worked with FQHCs, OBGYNs, pediatricians, and distributed these onesies so that families just began to see the census logo, and when they get the letter in the mail to complete the census, they feel a little bit more comfortable. Again, it's just kind of the subliminal message, but one way that we have engaged in civic health. We also did a really great partnership during the pandemic with our friends down in Southern Arizona that had this federal grant opportunity that I'm sure many of you are familiar with called REACH, Racial and Ethnicity Approaches to Community Health. This is all related to leveraging the federal resources, especially around utility assistance. What this partnership had was there was a utility company that had federal funding to erase the past payment bills of residents. So they would knock on their doors and try to get the residents to apply for the funding, and they weren't getting a response. And the corporate philanthropy arm asked other funders, what are strategies to help this? And what they ended up doing is partnering with a civic health partner that often canvasses those same neighborhoods for elections by encouraging people to register to vote and to actually get out the vote. So they are trusted community messengers. The County Department of Public Health, with local partners utilizing the reach efforts, partnered with that trusted community messenger to knock on those doors rather than the utility company. And because they were a friendly face, they had knocked on those doors before. The doors were answered. The residents were able to get apply for the utility assistance and get the much needed support they needed during the pandemic. And lastly, even though I know that this sector has experienced a lot of challenges the past few years, this sector is still seen as a trusted messenger for communities, and that is so valuable in this space. So the great organization VoteER has attached itself to this research that shows that this sector is a trusted community messenger and is partnering with FQHCs, public health officials, medical providers, doctors, nurses, to provide them training and resources to encourage their patients to register to vote and to actually get out the vote. This is done in a completely nonpartisan way. It's just simply another check-in to flex that civic muscle while they're visiting their medical provider for their physical and mental health. Again, that healthcare integration. So another way that public health officials, city and county health officials can get engaged as well. Vitalis is proud, again, to be able to be an evangelist for this message and to collaborate with the team at NACCHO and Johns Hopkins University to grow this body of research and to grow this movement. And we're so glad to be able to present this information today. With that, I'll toss it over to my colleague and friend from Johns Hopkins University. Janesse, take it away.
Thank you, David, and thank you, Robin. Really, really appreciate that. So, as my colleague said, I think all of us at Johns Hopkins University, we are increasingly compelled by the science and the data that's out there about how important civic participation and engagement is in terms of improving people's health. Go ahead to the next slide. So, look, just in summary, where does this leave us in terms of a conversation and in terms of some next steps that can be particularly helpful? So if I said that public health's job is, in part, helping people to be active participants in building and strengthening their communities, I think we'd all agree, yes, it is. That's part of our job to do that. That, my friends, is civic participation and civic engagement. And I think it's really compelling. The next piece of that is, in fact, that, when people are active participants in their community and they look to strengthen their community, it actually helps us do our job better. So it is actually very helpful to public health when people are active in these particular ways. And when we do our very best work in public health, it means that individuals and communities are at their healthiest. So if we can do good work, then communities are healthier. So these things very much fit together. And in so many ways, we can't not be partners in this space. Next slide. So why this moment? So we understand maybe why it's compelling to be in this space, but why now, I think, is part of the question. I think it's a few things. So one is we already know that this helps us do our own work better in the public health space. Increasingly, you're seeing that there's a body of evidence that is really indicating, look, we're not sure exactly how it intersects, but maybe it doesn't matter. We know that where people are more actively engaged, whereas there's more civic participation, where they're showing up for each other in important ways, those are the places that are the healthiest across the United States. We know that there's other organizations like NACCHO, like others, that are looking to take action. So NACCHO's colleague organizations are in this space. They're looking at this as another arrow in their quiver as well. And then I think lastly is we know that local really, really matters. But local health departments, all of us in public health, should not feel like this rests on our shoulders alone. So this is very much something that can happen in partnership, because frankly, a more civically engaged and participatory public benefits a lot of different sectors, not just the health sector, even though it's crucially important. So again, if we want to sort of ladder up in health, we have a 10-year goal around this. And while it's very specific in terms of the core objective and measuring is around voting, there's a whole host of ways that public health can get engaged here. And this may feel more or less doable in terms of a focus on voting than other places, but know that that Healthy People 2030 is really looking at this core objective as a way to measure and hopefully advance very good health in communities. So a couple things. I think we all want to leave with what are some tangible things. And Dave gives such rich examples of what's happening in Arizona. And we know that nudges are really helpful when they come top down, and they're also really helpful when there can be some experimentation that happens from the bottom up. And so here are just some potential actions, and think through whether this is right for your local health department or in collaboration with others. So a few things. NACCHO is there for you in so many ways, and there for all of us. So one of the ways is to really ask NACCHO and their partners to help provide a policy statement and a suite of tools that provides guidance at the local levels. So they've done a lot of thinking around this, but it'd be helpful to know if that's something that would really advance the thinking or the space to experiment within your local health department and community. A second then is to develop, ask NACCHO or others, this could happen in partnership, around whether it makes sense and it would be possible to develop a community of practice that includes expertise from Healthy People 2030, health departments, state health departments, non-governmental organizations, and philanthropic organizations like the one that David works with. And so you can just imagine the wealth of knowledge that could come together and sort of share best practice and innovations that merit further exploration. And then lastly is there a way to advocate for the development of a research agenda that helps us better understand which of these elements around civic participation really unlock better health? And so better understanding that, having a robust research agenda that could be advanced and supported through lots of different mechanisms could be extremely helpful as we seek to make more progress. The other way to look at this is say, okay, those things might need to happen and those nudges are helpful in terms of a top-down approach, but what could we really do, like if we went home tomorrow, and what could happen in our own communities? So first things first, find your local partners. One of the things and why the moment is now is that out of the pandemic, lots of our local health departments, we found different partnerships at the local level. And we were really creative about what those look like. This is the perfect opportunity to pull on those local partnerships, because an active and engaged public who's participating will help to advance all the issues that we really care about at the local level. So find your local partners, look for, engage whether there's interest, and then find the things that feel comfortable to you. And that could look really different politically. So while civic participation is not inherently political, we know that it can be viewed that way. So thinking through what feels most comfortable in our space. So is it collaborating on increasing volunteerism? Is it collaborating on how to show up at some of those public conversations like school boards or planning commissions or others? Is it looking to do some very targeted engagement in certain ways that impact health? Or is it really looking to increase voting within your community, recognizing that's so important when we think about social determinants of health and political determinants of health? And then I really heard this from a lot of local health departments, which is really think about starting at the neighborhood level. So it's really hard to be against healthy, safe neighborhoods. So what does it look like to imagine just what does increased participation and engagement look like even at a neighborhood level? And we know the correlation to and that the linkage to zip codes is just hugely important. And lastly, I think just as individuals, we always stand to gain from this, which is if this is feeling like a very new topic to you, there are ways. We have, in fact, contact us, any one of us, and we've got a list 5 times as long as this, but wanted to give you just the breadth of different ways that you might start to explore this on your own and just get smarter in this space of what does it look like? Why does it have such an impact on health? And where can I learn more? With that, let me just hand it back over to Robin to close us out.
Thank you, Janesse. And thank you, David, for your presentation. Thank you all for tuning in and being interested in civic engagement and how it intersects with public health. As Janesse mentioned, we are here and we have more content to share with you. If you're interested, we'd also love to hear from you. If you're working in this space, you're interested in collaborating, or you have ideas for how NACCHO can better engage in the civic engagement space and support local public health as you enter into this area, we remain available to you.